Cancer Center is hosting a free screening event looking for oral cancer. It is recommended that anyone over age 20 be examined because early detection saves lives. The screenings take place at CBCC on Truxtun Avenue in Bakersfield on Wednesday, April 13th from 5 to 7 p.m. Call to make an appointment. The number 616-1618. Taking aspirin even once a month.
All right, Dr. Ravi Patel with the Comprehensive Blood and Cancer Center. Our guest this morning for the Cancer Update. Good morning to you.
Good morning.
As we roll into Relay for Life this weekend, yes. It's a very exciting time. Cancer treatments are getting better and better.
Yes.
So let's talk. There was a question. Is it true that if you have cancer in one breast, it may be better to take out the other breast as well, even if there's not necessarily cancer in that breast?
Yeah, you know, the majority of the concept a lot of patients have is, you know, I've got this cancer, let's get it all out, you know. And it appeared to be true, but now there's more and more data coming out that it really is important that you don't go through the discomfort of an opposite surgery when you really don't need it. So the answer is you have to be very selective, select the right people where you need both the breasts removed.
Because I know people have been talking about mastectomies as kind of a preemptive after getting genetic testing. They say, I've got the gene, it's a good chance I'm going to get it, I should just have my breast removed right now. People have thought about doing that as well, right?
Yes.
But you're saying maybe not?
No. For those who have the BRCA1 and 2 gene positive, it's the right one. So they are the small select group of patients, but 80% of them will not need it.
Okay. All right. Another question. Does taking testosterone increase the risk of cancer, those injections?
Yeah, it's a big fear because, you know, testosterone sort of fuels prostate cancer. Interestingly enough, new studies show that really, if it's taken in the right way, it doesn't necessarily cause prostate cancer. So I wouldn't give it to somebody who has prostate cancer, but certainly those men who need it for a variety of reasons can certainly take it without the fear and monitoring of the cancer.
Of increasing their chance of getting prostate cancer. And finally, this is an interesting one. Everyone likes to go to the sushi restaurants, pop edamame, you know, little soybean pods. Does soy food products, are they safe for breast cancer patients? Because there's a lot of talk about estrogen, right, with soy products?
Yes, absolutely. Now, there's a difference between soy food products and soy supplements.
Okay.
And soy food products, in a recent study conducted by the American Association of Cancer Research, actually showed a decrease in breast cancer recurrence. So, you know, food products are okay at a level of about somewhere between 23 to 40 milligrams, but we don't know about the supplements as such. So soy overall is beneficial.
It's a good thing to eat tofu and things like that. What's in the supplement that's different? Is there more estrogen in those? You
see, the way the estrogen works in the original product versus the way it works in an extracted product is very different in the body.
Interesting.
And it's an estrogen promoter, and there was a fear that, you know, it could block some of the anti-hormonal medications for breast cancer, and this dispels that fear.
Okay, interesting stuff, Dr. Ravi Patel. We'll see you out there on Saturday. So much to do and so much to think about this weekend as we head to Relay for Life.
Exciting, actually.
Very exciting time. Thanks so much for coming in this morning.
Thank you.
All right, we'll take another quick break. We'll be right back. And welcome back. Every year, Bakersfield Relay for Life raises hundreds of thousands. This year, in fact, $2 million they're hoping for cancer research. That research, in turn, provides for better treatments, and it also provides for better tests that can detect cancer earlier. And doctors say those earlier detection tests are allowing cancer patients the possibility of living a lot longer.
You want to think, nah, that can't be possible.
A year and a half ago, Elisa Turner got what she thought was devastating news: aggressive and likely fatal breast cancer.
For 3 months, it was the most severe chemotherapy, and being 1 in 500 that reacted in a negative way, I was very sick.
Dr. Ravi Patel led the chemotherapy treatment, which he likens to throwing a bomb in a room, hoping it wipes out all the bad guys with the least collateral damage. Today, he says, gene research and treatment is changing that.
You can go only after the bad guys because there are selected genes within the cancer, so you can tailor a treatment which goes in, attacks only the cancer cells and not the normal cells.
That means using research dollars to understand how cancer causes the body's normal cells to grow out of control. Scientists are now looking into the cell on a molecular level. For instance, identifying how cancer cells induce the body to grow new blood vessels vessels that supply the tumor with nutrients. By learning how to block the pathway and blood vessel growth, doctors have essentially learned how to starve the tumor. And doctors now can even monitor how well treatments like that are working.
Your blood washes through tumor in your body, and it can take away some floating cells from the tumor into the bloodstream.
It's called circulating tumor cells, and the Comprehensive Blood and Cancer Center uses this machine to detect and count them.
We want to know if it's a white cell or a glial cell.
Tumor cells glow on the screen like a Christmas tree light.
If you treat the patient and the number of circulating tumor cells start dropping down, you know that you are on the right track.
And doctors are getting better at treating sensitive cancers with precision. The Cyberknife bombards brain tumors with a powerful dose of radiation with sub-millimeter precision, all the while avoiding sensitive areas like the eye, the optic nerve, and healthy brain tissue.
It can continually track the tumor and adjust the beam.
But doctors say early detection is even better. That's why doctors are using a new generation of PET scans that show exactly where the tumors are and how big.
It's like eating into the bone. You see, you see it should look like this on this side.
And over at Mercy Southwest Hospital, something as simple as a soft pad on the mammogram machine is encouraging more women to get this life-saving screening, which is all good news for patients like Elisa, who at one point wasn't expecting to live longer than a few months.
It can happen to anybody, and anybody can beat it. I'm living proof.
Well, one of the American Cancer Society's lead cancer researchers made a special visit to this year's Bakersfield Relay for Life. Dr. Paul Mills talked about a cancer study he's working on.